Hi everyone. I am officially updating you from the hospital. Um, I've been sitting here writing down in this little notebook my experience here at the hospital. This is my experience with mastectomy and reconstructive surgery, and one reason I wrote it down was because obviously I just had surgery this morning and I'm on pain pills. So I wanted to give you guys an update from me personally. Um, First and foremost, I want you guys to know that um, this isn't to be taken or interpreted as medical advice or what you should do, because what I should do, what I decided to do, and what you should do is two different things. I'm just wanting to give you my experience with what it was like to have a mastectomy and reconstructive surgery because I have the PABL2 gene. Um, and I have cotton mouth really bad. So anyway, I wonder if we could close that door. Um, it's all right. Surgery went very well. I had my first cocktail at 7:15 a.m. Ever, and I remember George giving me a kiss and a hug goodbye, or as they before they rolled me out. They rolled me out exactly at 7:30 a.m. and that's I don't even remember being rolled out. So that was because of the cocktail. I have no recollection. The surgery was done, finished, and I was being rolled out of surgery at 12:10. George said he looked up exactly at that time, and that's what time it was. And I got to the recovery room at 1:30. No, I got to this room at 1:30, and the doctor said that they had no suspicious tissue that was seen. I guess they send it off for a biopsy. Um, no lymph nodes were removed, and the reason Dr. Mangini and Dr. Lambert said that I'm getting cotton mouth again, so excuse me if I have to take a drink. Um, they said that if you don't have cancer, that creates a whole nother issue. So I don't have cancer, I have the gene that causes the cancer. Um, so if they take the lymph nodes out, then you have a risk of your whole arm going numb and um, swelling, and there's a term and a disease for it, but I don't recall what that is. So anyway, they didn't take any lymph nodes out. Um, let's see. I have drains in. There's both sides. There's drains. That's normal for a mastectomy. Um, let's see. Those have to be emptied, and the liquid has to be measured um, over a 24-hour period. And then the doctor said that the rate of the drainage determines how long that I have to keep those drains in. Hold on a second, I gotta take a drink. Mm, the cotton mouth's killing me. It's bad. So that determines how long I have to have these in. And when I went for my initial follow-up visit to the doctor's office prior to surgery, for blood work and all that other stuff, they said that people could wear this up to a month. So, but they could wear it like 4 days, a week, something like that. So who knows? Depends on how much I'm bleeding. Um, so if you had this surgery done and yours end up staying in a month, that's not weird. That's normal. Um, I can't lift my arms up over my head, which George has already fussed at me because I tried to put my own ponytail in. But it's good therapy. The doctor, when he came in to see me, it's good therapy to like roll your shoulders. It's like a physical therapy backwards and forwards. Um, why? Because you don't get stiff? Is that what he said? I'm pretty sure. Yes, that's what he said. Speaking of which, The first time that I got up, speaking of physical therapy, my legs were extremely weak, really weak. Never experienced that in a surgery. I thought that was bizarre. Um, Honestly, my first thought was, my God, did they remove my legs? Really, because I could feel them, but I knew, and I knew they were there. There's a term for that when somebody has an amputation. I can't remember what it is right now, but it's like missing a limb, and it was so weird. My legs were really numb, and George and the nurse helped hold me up to like wash my hands and stuff like that. My pain level has been good. It's not been really bad, but I'm staying up on my meds. Um, Plus, I had an augmentation prior to this years ago. So my muscle was stretched out. So I had a mastectomy and reconstructive surgery today. I actually had 3 augmentations because of ruptures prior to this. Anyway, everything happens in 3s and 4s, it seems like with me. Weird way to describe it, but I keep wanting to go like this and pull down. You know how ladies will know this, guys won't. But the sensation of an underwire bra like poking you, and you kind of want to take your bra and do that and kind of pull it down. You know how you pull your bra down and adjust. That's what this sensation underneath feels like right now for me. It's kind of like poking. But that's not to say that's what the pain feels like, because it's not. Like if I move my arms back or forward, then I can feel where that was cut across. How they cut you is on the side, and they cut you right in the middle of your breast, and then they cut the nipple out. So I can feel that, you know, when I move my shoulders. The word is shoulders back and forth. And it's a stretch. What else did I say here? I'm glad I wrote this down. I would never be able to do this. Also, we discover stuff about ourselves all the time. And you know what I learned today? Sitting here in the hospital, I learned, this is so cool, that, you know, it's not like I didn't know I love helping people, because I did. I did a business for like 11 years where we helped people. It was called Extra You, which I officially shut down the 1st of February. But anyway, my whole life I've liked to learn stuff and then turn around and teach stuff. I learned stuff. Even when I was 4 years old, if I learned ballet, I was wanting to teach the neighbor kids. If I learned how to add and subtract, I always wanted. So here I am sitting in the hospital and saying, oh, they gave me a little notebook and they gave me a pencil and I'm going to write down what I learned. So I just realized, because George is kidding me about working in the hospital and writing and taking notes, and I'm sitting here 5 hours after surgery. I woke up, I was up here at 1:30. I've still been awake. And I'm trying to keep track of what I learned today for you, for somebody else, to ease your anxiety. Because I know that this is a really, really, really stressful and horrible thing for some people. To me, it was a very proactive thing, and I did not make this decision out of fear, because I've made too many decisions out of fear, and they were bad decisions. So, I just want you guys to be comforted as much as possible if you have to make this decision. And so I'm really jazzed about being me. Isn't that cool? Hold on. Lastly, ladies, my books are about identity. And so how cool is it that this really ties into that? Because you know what? I wrote this down. Your identity is not about your tatas or your experience. It's not. You know what it's about? It's about what's in your heart and what's in your mind. And that's what your identity is. So don't be a stubborn boob. Do what's good for you. Love y'all. Bye.